So if you notice a bulge when you wipe or perhaps a dropping or dragging feeling, it could be prolapse. So tell me, Dr. Liz, what causes prolapse?
So prolapse is, when we talk about it in gynecology, it's when the vagina sort of turns itself a little bit inside out, sort of like a sock, and it can be caused by a lot of things. It might include, after childbirth, it becomes a bit more common with age. Strenuous activity can do it too, so weightlifting, and then if you carry a lot of weight yourself, it may be more notable. And then there are some medical conditions that are associated with prolapse where they have like some women have problems with the collagen, so the tissue's a bit weaker. There's a few different causes of prolapse.
So how can it be prevented then? Because it doesn't sound very nice.
It can be prevented by a few things. So if we go way back when, you might, just monitoring your weight gain in pregnancy, trying to do pelvic floor exercises after childbirth.
Lift your buttons, ladies, at the lights, all right? Every time it's a red light, traffic light, lift those buttons.
Do some pelvic floor toning. Avoiding really strenuous activity over very long periods of time. So there are some people that their job may involve a lot of heavy lifting, and they might be a little bit more prone towards prolapse as well.
So how can prolapse be treated then? Because obviously it's not something that you want to have.
Yeah, so you might do something quite simple like avoiding really heavy activities or activities that you notice provoke those symptoms. So a symptom of drag or a bulge on wiping when you go to the bathroom. So that is the first thing. Avoid the things that trigger it, but also pelvic floor exercises. And then we've got other management options. So one option is a pessary. So a pessary there's different types, and they're these made of often a silicone, so a medically inert silicone, which is for example, a ring that can go into the vagina, and you can be taught to self-care for the pessary if you'd like to, or alternatively you can see a GP, a nurse or a gynecologist for follow-up of a pessary. And the pessaries, you can have them in until the end of days. They're really quite safe. They're an alternate to another management option, which is surgery. So surgery for prolapse is available. There are different surgical techniques, and surgery for prolapse is performed by a gynecologist or a urogynecologist, and different surgical approaches include keyhole or vaginal surgery. There's quite a bit of controversy around the use of mesh for vaginal prolapse. There's a broad number, there are many, types of surgery, so it just depends on what type of prolapse you have. Because we talk about bladder prolapses, so what that means isn't that your bladder's falling out, it means that the vaginal wall that makes contact with the bladder is dragging down. Or we talk about a bowel prolapse or a rectocele, like that means the back wall of the vagina is coming down. Or we talk about a uterine prolapse where the uterus itself is coming down.
So prolapse can be a bit frightening, I guess, when it happens, especially if you've never had it happen before. So if you suspect you may have a case of prolapse, contact a professional such as Dr. Liz to help you resolve the issue.